primarily today, we're looking at payer published commercial rates and how to analyze that data. So this is kind of where we approached HCCI to really get some third party validation. And HCCI holds one of the largest, I think you told me, John, databases, claims data. And they are certainly experts at this. And we wanted to kind of compare these, but I'll let you maybe describe the project that we came up with here.
Yeah. So, sort of HCCI's mission with transparency, obviously the tick data has been on our radar for a while since, the first files were published and we couldn't open them. We're data experts and there's a technical issue with the JSON files and just the sheer size of these data sets. Yeah, becomes a technical complication and cost prohibitive for most small organizations. So we were happy when we kind of met Gigasheet and kind of realized we had this ability. Yeah, they had figured out some of the technical issues, and we had the expertise in kind of thinking through healthcare costs and what we could do with this data. But one of the main questions since the first tick files were published was: is it a useful resource for the types of research we do, which is market analysis? Are these costs reliable? And so that was kind of the first objective of this project was based on what we know on the claim side, which is negotiated amounts, and we know the services occurred and they got paid at a certain rate. How does that compare to the tick data? And is there a way for us to look at estimates we've calculated with claims data and try to replicate that with the tick data? And so that was, we said, well, that's a great idea. How do we narrow that scope? So we've done a lot of work on maternal health care and childbirth costs over the years. So we thought that might be a good area to focus in on, as it's the most common admission for the commercially insured. And kind of hospital service. So that's a little bit narrows down the provider list and just the size of the analytic file we would be working with. And then we said, well, we could do it nationally, but let's narrow the geographic scope to again narrow it down so we could really get under the hood of the data and make decisions on what do we have to do to clean this to get it to the analytic file. So we zoomed in on Pennsylvania as a state, which Gigasheet had already had a lot of the tick data available for that state. And it's fairly representative of the US as far as the types of geographic areas, urban, rural, other diverse state. And so that was kind of how we got to this research question of looking at the variation in childbirth costs for in the state of Pennsylvania within the tick files and how that compared to our commercial claims estimates for the same thing.